I'm thrilled to be here today. I didn't expect to get a little overwhelmed and emotional, because that's not normally me in front of a microphone. The question mark. I wasn't sure what we were going to talk about today, how to introduce the start of this meeting. And then it occurred to me that it's the questions that we need answered. Why do people get sick? Why are we having trouble treating it? We don't know. So when I looked at these question marks, I said to myself, have you ever answered a question for a 2-year-old? You give them a really logical answer and they say, but why? And you answer it again and they say, but why? I hear the laughter, but as people were coming in, what I heard was a tremendous thirst for knowledge. That's the question. Why am I sick? Why is this happening? Why are the side effects from the drugs? It's that 2-year-old in each of us that we need to bring forth to ask the questions, why? And when we have answers, especially when they seem so logical, we need to ask why, and is it the right answer? A couple of examples. Over and over we hear, what comes first, bronchiectasis or NTM? Is it one or the other? But why does that happen? Of course, the big question is, how do we cure the problems of the lung tissue? Is there a way to cure bronchiectasis? Because once that's there, you set up for infection over and over again. There's another question that's been asked, is do we need vitamin D supplementation? Now, I'm not going to get into the medical side, but it's a question that I wanted to pose to back up why I'm asking why and questioning things. Last week, many of us have heard to increase vitamin D levels. Last week there was an article published out of London, England, and it questioned, is vitamin D the cause or the result of lung disease? They still recommend the supplementation, but they actually questioned, are people who are ill spending less time in the sun, and is their vitamin D therefore dropping? Asking the right questions is going to be the key to moving things forward. I think that's the greatest risk, not asking the question. We can't let the shortage of funding, I heard about that numerous times earlier. We all know about sequestration. We all know about government deficits, and I've heard from various physicians and researchers about challenges to get funding to move things forward. I've heard that for 17 years, and it's not going to change. We have to figure out ways around it. Technology is speeding things up, but we can't let that lead us to very specific answers without questioning them. It's taking that broad look at things and querying and drilling down. Today, we're honored to have with us some of the brightest, most experienced, most inquisitive minds in the field of pulmonary and infectious disease medicine who are interested in NTM. But from personal experience, I can say that their expertise on the professional side is only a fraction of the dedication I have seen when they are working to take care of an individual patient or to find answers that impact all of you. And I know a lot of the physicians in this room, and it's humbling to stand here and look at you knowing how dedicated you are to taking care of your patients. Thank you to Lankenau Medical Center for hosting this to Dr. Donald Peterson and to Dr. Leah Landy for arranging to have this meeting hosted here. We also thank Rebecca Quate for all of her work working with our organization to coordinate this meeting. I also want to say thank you to Susan Wislaseni, our Director of Operations, who made sure that everything happened to bring this together, and to Amy Leitman, yes, our daughter, who works full-time in our organization, working with Susan, who simply doesn't understand the answer no, worked tirelessly to make sure everybody knew that this meeting was happening. And before I go to the last thank you and the next introduction, when Fern became ill 17 years ago, but she's here, she needed a lot of care and a lot of therapy. And Amy, our daughter, and our son Jason, every week took a day out from school. Instead of having lunch with their friends, they were at our house helping. It really does require a lot of help. And for those of you who are patients, and for those of you who are family members of patients, we all understand it. I think your doctors do too. Finally, I want to say thank you to my inspiration, Fern. She was the one who was lying in a hospital bed in Denver, critically ill, being taken back from National Jewish to University Health Center to have a bronchoscopy with a very high fever and complications. And she said to me, go back over to National Jewish and tell, I'm going to omit the name, that she's not as sick as I am, this is not going to happen to her. And it was Fern who said, as things came up, we've got to help other people. That led to the website, and the rest of it's a natural progression. Thank you, Fern, for fighting to be with us.